Hello everyone and welcome. Today we are going on a fascinating journey inside our mouths to learn all about our amazing teeth. Think about your smile for a moment. It's one of the first things people notice. It helps you show the world when you're happy. Having a great laugh with your friends and family. Your teeth are also super important for chewing delicious food. They help you speak clearly. But just like anything precious, we need to take really good care of them. Sometimes little problems can start. One of the most common is something called tooth decay, or what many people call cavities. It's a bit of a sneaky problem, but the good news is that we can totally stop it. So what exactly is tooth decay? Imagine your teeth are like strong, shiny castles. Tooth decay is like a tiny troublemaker trying to make a small hole in the castle wall. It doesn't happen overnight. It's a slow process that can affect anyone. From toddlers to grandparents, everyone's smile needs protecting. Let's get started. Let's pull back the curtain on our first shocking fact. Tooth decay is actually caused by tiny germs or bacteria that live in our mouths. It's true. Everyone has them, and they aren't all bad. But there's a specific type of bacteria that absolutely loves to eat sugar. When you eat or drink something sugary, a fizzy drink, a sweet biscuit, sticky fruit snacks, these little germs have a party. They munch on the sugar and, as they do, they produce a type of acid. It's this acid that is the real villain in our story. It's a bit like spilling lemon juice on a soft stone over and over again. Sugar is the main fuel for these acid-producing germs. It can hide in many foods we might think are healthy, like breakfast cereals, yogurts, or pasta sauces. It's not just the obvious culprits like sweets and cakes. The more often you snack on sugary things, the more often you are feeding these germs. It's the frequency of sugar, not just the amount, that gives the acid more time to attack your teeth. Now, let's talk about plaque, that fuzzy, sticky film that helps the acid stay close to your enamel. So what actually happens when that acid starts its attack? Here's our third shocking fact. The first stage of tooth decay is completely silent and invisible. It begins with a process called demineralization. The acid produced by the bacteria starts to dissolve your enamel's minerals. Your tooth enamel is the hardest substance in your body, made of tightly packed mineral crystals. The acid creates tiny weak spots, sometimes a small, chalky white spot on the tooth, but you won't feel pain yet. At this stage, it's silent. You may not notice anything. Your saliva is a natural hero. It washes away food and acids and contains minerals like calcium and phosphate. These minerals help to rebuild enamel in a process called remineralization. It's a constant tug-of-war on your teeth. Demineralization from acid versus remineralization from saliva. As long as saliva wins, your teeth stay strong. However, if acid attacks happen too frequently, for example, sipping a sugary drink all afternoon, your saliva can't keep up. The demineralization process starts to win the battle. The weak, chalky spot gets weaker until the surface finally breaks down. The weak spot turns into a small hole, a cavity. Once decay breaks through enamel, it reaches the next layer, dentine. Because dentine is softer and contains tiny tubes to the nerve, decay can spread faster, and you may start to feel sensitivity to sweets, hot or cold. When a cavity in the dentine is left untreated, the decay keeps traveling deeper. The next stop is the pulp, the very center of your tooth. It contains living tissue, nerves and blood vessels, essentially the tooth's life support system. When bacteria reach the pulp, it causes inflammation and infection, a condition called pulpitis. This is when the real pain often begins, a constant throbbing toothache that makes it hard to eat, sleep, or focus. An infection in a single tooth can affect your overall health. Your body tries to fight it, but bacteria can overwhelm defenses. That can form a pocket of pus, a dental abscess, a serious infection. You might notice swelling of the gums, face or jaw, fever, and feel generally unwell. In rare cases, it can spread to the jaw, neck, or even the brain, leading to life-threatening complications. A young footballer, Leo, missed a big game because he ignored a small cavity that turned into an abscess. His story shows why getting help early matters. A small cavity can often be fixed with a simple filling. If the pulp is infected, root canal treatment removes the infected tissue, cleans the canals, and seals the tooth. Worst case, a tooth may need extraction, which affects chewing and can make other teeth shift. That's why catching decay early through good habits and regular checkups is the best option. Now for the best part, fighting back. You have amazing superpowers you can use every single day to defeat tooth decay. The first one is your toothbrush. Brushing properly is the single most effective way to remove that sticky plaque blanket. Our sixth shocking fact is a positive one. Brushing for 2 minutes twice a day can stop the acid attack in its tracks. Use a toothbrush with soft bristles and a pea-sized amount of fluoride toothpaste. Hold the brush at a 45-degree angle to your gums and use gentle circular motions. Brush all surfaces of every tooth, the outside, the inside, and the chewing surfaces. Brush your tongue gently too. Set a timer for 2 minutes. Sing a song or listen to a tune to make it fun. But even the best brusher can't reach everywhere. Plaque hides in the tight spaces between teeth. This is where your second superpower, flossing, comes in. Flossing is like sending a special cleaning crew into those hard-to-reach spots. Curve the floss into a C around each tooth and move it up and down along the side, sliding just under the gum line. Use traditional string floss, a floss pick, or a water flosser. Choose what works for you and do it every day. It might feel awkward at first, but with practice it becomes quick and easy, and your whole smile will be healthier. Brushing and flossing regularly gives you a bright, healthy smile. One less thing for Decay to celebrate. Your diet plays a huge role in the health of your teeth. Here's our seventh and final shocking fact. Some foods can actually help you fight cavities. While sugary foods feed the bad bacteria, other foods can help clean your teeth and strengthen enamel. Crunchy fruits and vegetables like apples, carrots, and celery scrub teeth and stimulate saliva. More saliva means more natural rinsing and minerals to remineralize your enamel. Water, especially fluoride water, is the best drink for your teeth. No sugar, no acid, and it helps rinse particles away. Milk and plain yogurt are great choices. They're high in calcium and phosphate. These minerals help rebuild enamel after acid attacks. It's unrealistic to avoid sugar completely, but when and how you eat it matters. Try to limit sugary snacks and drinks to mealtimes. During meals, your mouth produces more saliva, which helps wash away sugar and neutralize acid. Make smart swaps. Instead of sweets, try a handful of nuts or a piece of cheese. Cheese helps neutralize acid and provides calcium. Swap fizzy drinks for water or milk. A young patient, David, swapped his daily fizzy drink for water, and at his next checkup, his teeth were noticeably healthier. Small changes like these can have a massive impact over time. Think of eating as part of your daily dental routine. Choose tooth-friendly foods and drinks to keep enamel strong for years to come. Finally, let's talk about your partners in Smile Health, your dental team. Visiting the dentist regularly for a checkup is one of the most important things you can do for your teeth. Think of your dentist and hygienist as friendly detectives with special tools and lights. They can spot early signs like chalky white spots long before you would notice them. Catching decay early means it can often be stopped or even reversed with simple treatments. Treatments such as fluoride varnish can protect enamel without needing a filling. A hygienist gives your teeth a professional clean, removing hardened plaque called tartar that brushing alone can't remove. Professional cleaning leaves teeth smooth and gives you a fresh start against plaque. Some people feel nervous about the dentist. That's okay. A kind dental team will listen and go at your pace. People like Mrs. Garcia used to be anxious. Now she looks forward to visits because her dentist explained everything kindly. A dental checkup is about more than cavities. They'll check your gums, bite, and screen for other issues. They also screen for broader oral health issues that affect your overall well-being. Taking care of your teeth is a team effort. It involves you, healthy habits, and your dental team. Don't wait. Schedule regular checkups as a proactive step for your overall health. Your smile is precious and deserves the best care. Keep up the great work, Smile Keepers. A healthy smile is a happy smile. Thank you. And don't forget to like, share, and subscribe.